Wrist sprains can occur in one of four joints: the distal radial ulnar joint, radiocarpal, midcarpal, or the carpal metacarpal joints. In sports, it's most commonly going to involve the radiocarpal joints, and you will see this in divers, skaters, or wrestlers. The mechanism of injury can occur in many different ways. Fouche is very common. Any hyperflexion movement, torsion that occurs on the wrist, or in the case of gymnasts, you may see a combination of hyperextension, ulnar deviation, and intercarpal supination. Signs and symptoms may include generalized wrist swelling over the carpals, pain that is generalized throughout the wrist and or deep-seated. The patient may be point tender on the dorsum of the radiocarpal joint. The pain increases with active or passive extension, and the patient will complain of a decreased ability to weight bear on the wrist. Special tests that are used include the glide test at the radiocarpal and ulnar carpal joints. We can also use a valgus and varus stress test at the wrist. An X-ray will be performed to rule out fractures, specifically the scaphoid or other carpal fractures. We may be also wanting to rule out tendinitis or tenosynovitis, and treatment will consist of a prophylactic taping or bracing.